Hi everyone, this is Anne or Annalie. Welcome back to my review video. Today we're going to review Chapter 3, Workplace Settings. We're using the Canadian textbook for the support workers and I'm using the 2022 edition. So let's begin by answering question number 1. Multiple choice, choose the best answer. As a new graduate, you may risk legal action by A. Seeking assistance before attempting a new procedure, B. Performing tasks that are outside of your role, C. Staying within your scope of practice, and D. Avoiding situations with clients that may be uncomfortable. The correct answer is B. The support worker's scope of practice in any province, territory, city, or municipality is determined from three important sources. One, provincial or territorial educational standard of practice. Two, employer's policies. And three, supervisor. Every employer has written policies that establish what can and cannot be done by support workers. These policies should be read carefully before starting work. Never act beyond the legal limits of your role. Also, never perform a function or task that you have not been trained to do. If you perform a task that is outside these limits, you could harm a client and create serious legal problems for yourself and for your employer. Question number 2, true or false? In a community day program, the support worker works independently. The correct answer is false. Benefits and challenges associated with working in a community day program includes working closely with a team and a supervisor. Teamwork can be a success if team members share a common goal and work well together. It can be difficult, though, if conflicts occur within the team. Effective communication skills are necessary. Question number 3, multiple response. Choose all of the correct answers. A chronic illness is an illness that A is ongoing, B may worsen over time, C usually has no cure, and D is usually fatal. The correct answers are A, B, and C. A chronic illness, also known as persistent illness, is an ongoing illness, slow or gradual in onset, that may or may not grow worse over time. Examples of chronic illnesses are diabetes, multiple sclerosis, and Alzheimer's disease. Chronic illness cannot be cured. The focus of care is on preventing complications of the illness. Number 4, true or false, retirement residents are financed by the government. The correct answer is false. Regulations governing retirement residents vary. In some provinces and territories, they are usually privately operated and not financed by the government. The residents are required to pay the full cost. Standards, prices, and services differ from one facility to another. These facilities may be small converted houses or high-rise apartments. Residents in retirement homes do not have illnesses or disabilities that prevent them from meeting their own personal care needs. Question number 5, true or false? Some hospitals hire support workers. The correct answer is true. Work settings and services provided by the support workers includes acute care or hospitals. Number 6, true or false? Support workers are responsible for 80% of the total hours worked by all home care workers. The correct answer is true. Home care is a vital part of Canadian healthcare system. Support workers have a central role within home care. It has been estimated that support workers are responsible for 80% of the total hours worked by all home care workers. Number 7, true or false? Working in a facility requires you to do many tasks in a limited period of time. The correct answer is true. Support workers must provide thorough, competent, and respectful care within a short time. This ability requires self discipline, dedication, and efficiency. Number 8, true or false? A lack of privacy can lead to loss of self esteem. The correct answer is true. In any work setting, support workers must respect their clients' privacy and dignity. Lack of privacy can result in loss of self esteem, particularly during personal care. Example number 1, remember to knock on the door and announce your presence before entering the client's room. 2, avoid discussions with coworkers not involved in the client's care about the client's health records and status. C, respect client's property and recognize client's right to express their preferences. Number 9, multiple response. Choose all of the correct answers. What types of services do Community Day program offer? A, respite for family members. B, rehabilitation. C, counseling for people who have mental impairments. D, recreational activities. And E, personal care services such as nail care. The correct answers A, B, C, D, and E. An adult community day program, also called adult daycare center or adult day program, is a daytime program for people living with physical or mental health issues or for older persons who need assistance. Day programs aim to meet the client's needs and provide a break for family caregivers. Some programs offer rehabilitation to people with disabilities. Others offer counseling to people with mental impairment, and many day programs offer recreational activities such as arts and crafts and social events, films, and other board games or card games. Number 10, true or false? Another term for acute care is convalescent care. The correct answer is false. Acute care is provided for a relatively short time, usually days to weeks, and is intended to diagnose and treat an immediate health issue. It is provided mainly in hospitals. An acute illness appears suddenly and lasts a short time, usually less than 3 months. Symptoms can be severe. Examples of acute illnesses are pneumonia and influenza. Question number 11, multiple response. Choose all of the correct answers. An acute illness is described as an illness A, that appears suddenly, B, that is recurrent and untreatable, C, that lasts a short period of time, and D, that has symptoms that are severe. The correct answers A, C, and D. Acute care, healthcare that is provided for a relatively short time, usually days to weeks, and is intended to diagnose and treat an immediate health issue. It is provided mainly in hospitals. An acute illness appears suddenly and lasts a short time, usually less than 3 months. Symptoms can be severe. Examples of acute illnesses are pneumonia and influenza. Number 12, multiple response. Choose all of the correct answers. Working in home care presents issues and challenges such as A, working on your own, B, taking directions from different professionals. C. Undertaking difficult tasks such as shoveling snow. D. Maintaining professional boundaries. E. Providing for client safety. F. Providing for your own personal safety. And G. Working with other team members. The correct answers A, B, D, E, and F. Benefits and challenges associated with working in home care are as follows: A, working on your own; B, flexible working assignments; C, taking directions from different healthcare providers; D, maintaining professional boundaries; E, providing for client safety; F, dealing with people in distress; and G, providing for your personal safety. Question number 13, multiple choice, choose all of the correct answers. Examples of acute illnesses include A, pneumonia; B, Alzheimer's disease; C, influenza; and D, kidney stone. The correct answers, A and C. An acute illness appears suddenly and lasts a short time, usually less than 3 months. Symptoms can be severe. Example of acute illnesses are pneumonia and influenza. Number 14, multiple response. Choose all of the correct answers. A live-in facility provides care to people who A, are too young to live on their own; B, cannot care for themselves at home; C, can care for themselves independently but are too lonely to do so; and D, require basic care but not acute medical care. The correct answers, B and D. A live-in facility is a facility that provides living accommodations, care, and support services. These facilities vary in size and levels of care and support. People living in these facilities are called residents. These facilities provide care in a comfortable, home-like atmosphere and ensure that they meet the emotional needs of the residents. Clients need live-in care when they require supervision and assistance with some or all of their ADLs, but do not need acute medical care or high-level nursing care. Such clients include the following: frail, older persons, individuals of all ages who are living with physical disabilities, mental health challenges, or both, individuals with substance addiction. Number 15, multiple response. Choose all of the correct answers. Examples of a chronic illness include A, bone fracture; B, diabetes; C, recent urinary tract infection; D, multiple sclerosis; and E, appendicitis. The correct answer is B and D. Chronic illness is also known as persistent illness, is an ongoing illness, slow or gradual in onset, that may or may not grow worse over time. Examples of chronic illnesses are diabetes, multiple sclerosis, and Alzheimer's disease. Number 16, multiple response. Choose all of the correct answers. The goals of long-term care are to A, provide care leading to a complete recovery or care; B, maintain the client's health and independence to the greatest extent possible; C, meet clients' physical, emotional, social, intellectual, and spiritual needs; and D, provide opportunity for client to care another client. The correct answers, B and C. The goals of these facilities are to maintain the client's health and independence to the greatest extent possible and to meet their physical, emotional, social, intellectual, and spiritual needs. Long-term care provide accommodations, 24-hour professional nursing care, and support services to clients who cannot care for themselves at home but do not need hospital care. Most residents, though, are young, middle aged adults who are living with severe chronic health conditions or disabilities. Number 17, Number 17, multiple choice. Choose the best answer. Your client was admitted to a subacute care facility. Another name for this is A. Convalescent care, B. Hospital, C. Outpatient facility, D. Long-term care facility. The correct answer is A. Subacute care, also known as convalescent care or complex continuing care, healthcare or rehabilitation for people recovering from surgery or injury or being stabilized after a serious illness or health challenges. A client in subacute care is in stable condition but needs care requiring complex equipment and procedures. Number 18, multiple choice, choose the best answer. Support worker can maintain professional boundaries with clients by A. Refusing to drive a client to a medical appointment if asked, B. Not discussing personal problems with clients, C. Avoiding eye contact with clients or family members, D. Giving out her home telephone number to clients. The correct answer is B. Discretion in support work includes keeping personal matters out of the workplace. Your role is to focus on your clients and the task at hand. Do not discuss with clients your family matters and personal problems or the problems of others. Question number 19, multiple choice. Choose the best answer. Mrs. Jones received community-based services. This means A, she receives care in her community hospital. B, she receives care after admission in a long-term care facility. C, her health care services are supplied outside of a facility. And D, she can receive care only in her home. The correct answer is C. Examples of community-based settings include clients' home, group homes, and retirement homes in which clients live as independently as possible. The most common community setting is the client's home. Community-based services include the healthcare and support services provided outside the facility, such as 1. School boards, 2. Community health centers, 3. Doctors' offices, 4. Home care agencies, 5. Day programs, and live-in facilities. Question number 20, multiple choice, choose the best answer. Julie and Marie are newly hired support worker at a care center. Marie was provided with a written list of expected tasks and duties. Julie was not provided. Why should Julie ask for one? A, so Julie can find out which agency has the easiest set of duties. B, so you can negotiate which duty you want to eliminate. C, so you know what your coworker should be doing. And D, so you understand which tasks fall within the job description. The correct answer is D. Every employer has written policies that establish what can and cannot be done by support workers. These policies should be read carefully before starting work. Perform only those procedures that you are permitted to do according to your facility's policy. Also, never perform a procedure unless your supervisor is allowed to train you on that procedure and has given you sufficient training so that you're comfortable doing it. The facility will have written policies to guide you. Number 21, multiple choice, choose the best answer. In home care, support workers, A, have a secondary role within home care. B, are responsible for a wide range of home care services. C, are hired on a part-time basis only. And D, do not have to take direction from others. The correct answer is B. Home care is a vital part of Canada's healthcare system. Support workers have a central role within home care. Support workers are responsible for providing a range of home care services, including assisting with personal care, child care, transportation, and home management. Number 22, multiple choice. Choose the best answer. Restoring a client to normal or near normal function is the aim of which type of care? A. Respite care. B. Rehabilitative care. C. Assisted living. And D. Extended care. The correct answer is B. Rehabilitation services and restorative care are therapies and educational programs designed to restore and improve the client's independence and functional abilities. These services are for people who are ill, injured, or disabled. Hospitals, live-in facilities, and clinics offer rehabilitation services. Services may include like skills training, occupational therapy and rehabilitation services, behavioral management, speech therapy, physiotherapy, job coaching, and family counseling. Support workers may assist the client with personal care or activities of daily living or ADLs, or assist with program delivery. End of chapter 3 review questions. Thank you for watching this video. I hope you will watch the rest of the videos as well. Thank you.